Welcome to our Wellness Wednesday Health Show. I'm your host, Dr. Kala Ewell from the Back Pain and Joint Center of Texas. And once again, we are on location at the beautiful new location of Roberds Pharmacy with Van. Van, welcome to our show today.
Oh, thank you for having me.
Now, Van, tell us a little bit about Roberds Pharmacy, how it got started, and a little background.
Okay. So Roberds Pharmacy has been around since 1980. So we're actually one of the first compounding pharmacy, actually the first compounding pharmacy in the area.
Okay.
So it started from Jody Roberts started the pharmacy, and he's been compounding since then at the Rivershire location. So, and then in 2006, with renovations and change of setting and everything and technology, he moved to the location at Medical Center Boulevard,
Okay.
which is across from Conroe Regional Hospital.
And I think most people are probably familiar with that location because it's been there for the past decade plus.
Yes,
Okay.
yes. And then I joined him in 2009, started working for him, and I graduated probably a year after.
Okay.
Graduated in 2008, and so a year after I joined him, and it was passion, and really my passion in compounding was really high at that time. So luckily I joined the company, and I started working for him for about 12 years. I took over the pharmacy in around 2016.
So those of you who don't know, has Jody faded into retirement?
So he works for me since 2016, and then he's slowly getting into retirement.
Okay, so he started the next chapter, and then I think it's great that you've kept the name. I love it, established since 1980. Now, you mentioned compounding pharmacy, and so if someone's watching this, they may be thinking, okay, what's the difference between a compounding specialty pharmacy like Roberts versus a Kroger or a CVS?
Yeah. So compounding pharmacy, it's customized medications that were made to individualize the therapy for the patient for their unique needs. And so we start everything from scratch, like for example, hormones. We also do pet medications. We do suspensions for kids, dental products, things like that, which are not commercially available. So we don't just count, from off the shelf bottling and things like that. So that's the main difference.
Because it sounds like you do more specialized and customized things, is it more expensive for someone to go here compared to a normal one to fill the prescriptions?
Not really. So the FDA, the fun thing is the FDA do not want us to compound anything that's commercially available. That's the one thing. The second thing is we cannot compound anything that's based on price.
Okay.
So, for example, there's a vaginal cream out there called, for example, Estrace. So it has estradiol in it. Without insurance or with insurance, your copay is probably about $50 to maybe $100. So we can compound something that is similar but different ingredient, but does the same or even better efficacy, and we can price it for like $30, $40.
So sometimes it may even be a better price.
Mm-hmm.
Okay, because some people are like, well, I go to Kroger because it's the best price. So really, as far as pricing, it's very similar and sometimes less, but you get more customized, personalized service.
Right.
You have a handful of things here. Let's go over some of the ones you brought today.
Okay, sure. So for example, I work a lot with kids. We dispense a lot of medication for kids. So we do suspension, and we have a little insert here that they can invert the bottle and pull out the dosing that way. And then we also do lollipop. We make lollipops, Tetra King lollipop for kids.
Okay.
So patient after a tonsillectomy, they have a lot of pain in the throat, so the patient just suck on the lollipop for 5 to 10 seconds, and then it numbs the throat.
Oh, that's cool.
So a lot of ENT doctors, they love this product. I also do a lot of hormone prescriptions at the pharmacy, and that's for men and women. So men, actually women is a lot more complicated. So we have estrogen, progesterone, testosterone, DHEA. Also, I do a lot of adrenal gland testing for the cortisol and DHEA.
So let's go back to that. If someone is concerned about hormone imbalances, can you do some testing at your pharmacy without them having to go to their primary doctor?
So it's a triad relationship where I work with the physician and the patient. So the patient would grab the test from me, and then I would say, make sure your doctor is open to my recommendation.
Okay.
So they would buy the kit from me. I'll go through all the instruction for them to go home and do the test on their own. 2.5 weeks later, the results come back. I call them in and fill out a questionnaire with a bunch of symptoms and things like that. And then I would walk them through what kind of symptoms they have, explain to them the results of the saliva test or a blood test on the hormones, and then I would write a formal recommendation and send it to the doctor.
So if their primary care doctor doesn't specialize or isn't as familiar with it, it sounds like they can come to you first.
Yeah.
you can, everything from getting the labs ordered, doing the testing, get it as a pharmacist, letting them know exactly what they need, and then just really delivering it to the primary care so they can write the prescription.
Correct, yeah.
Okay.
So I am here working with the physician and the patient as a triad relationship. I am not here to steal the patient from the doctor, because the patient still has to go see the doctor. Okay. And then they prescribe, they approve the prescriptions, my recommendation.
Okay. I think that's really cool, because sometimes I've heard from patients that it's hard to get into their doctor, or maybe they have to wait a few weeks, or maybe the doctor's not as familiar with hormones because they haven't brought it up. But it sounds like you can help form that relationship and coordinate those things.
And one more thing is, the patient always call me like month after month to report the symptoms, and I can tweak the dosing based on the protocol that the doctor approved. Because a lot of doctors out there, they don't have the time to talk to the patient, and the patient cannot talk to the doctor that way.
And would you consider this more like functional medicine, that aspect?
Yes, yeah.
Now, what a lot of people may not understand, and just because I've known Van for a few years, Van does a lot of functional medicine work, which it's different than go to a pharmacist and they fill the prescription, right? You actually look for ways that how can I help restore balance to imbalances in the body.
Correct, yeah.
Okay.
So I got into functional medicine about, I would say, 8 years ago. So not just compounding, because that's how it leads me to functional medicine. That's anti-aging and functional medicine, holistic care. So I got into A4M and IFM. I got certified through those, and functional medicine is now my new passion.
So if you had to describe functional medicine to someone who's never heard it before, who's watching our show today, how would you put it just in a basic generic terms?
Sure. So you are looking at the patient, trying to help them by finding the root cause of the problem. A lot of these patients have a lot of chronic diseases, which they cannot find any answer or find any treatment from traditional medicine. And so they reach out to functional or holistic care doctor, and that's how they find the answer. And a lot of these patients we actually see, and it comes from different providers that refer these patients to us, or they find us through our website, and they come and they do testing. We also, besides hormone testing, we do food allergy testing. We do mold toxicity testing as well. So all of those actually will help kind of find the answer for the patient, and that's our goal.
I think that's so just amazing that you're off that. We're in the midst of this big shift in healthcare, right? For so many years and decades now, it's all been about, hey, what prescription medication can alleviate the symptoms short term?
Right.
But now this functional medicine, which has been happening for several years, but again, it's a big wave where people are starting to catch on. It's, hey, I just don't want to take a pill to give me symptom relief. I want to actually find out where's the imbalance, how can I restore balance to my body, and then the symptoms go away because things are restored in a more natural manner.
And I want to add something to that. It's funny because we also do regular commercial products at our pharmacy. So I do still count pills, grab stuff from the shelf. We're a hybrid pharmacy, so we do both compounding and regular commercial products. So when a patient comes up to me filling for example, a statin drug for cholesterol, so I would go and counsel the patient and say, okay, you're going to take this at nighttime, try not to eat or drink grapefruit juice and things like that to avoid the side effect. But then on a side note, I show them, what lifestyle medication can do, lifestyle intervention can do to help lower cholesterol naturally. Take a good fish oil, a pharmaceutical or professional grade supplement, fish oil, or buy a Lipitrol, things like that will help lower the LDL, bad cholesterol, raise up the HDL, good cholesterol. And then, don't stop your medication. I'm not here to tell you to stop your medication. You're gonna try and get on those. Eat right, food is the real medicine, and then eventually a couple months later do another blood work on your cholesterol. If you see a great improvement, then talk to your doctor. Maybe they can cut the dose in half and eventually try and get off of the medication.
I love it because it's so much more.
Yeah.
And it's really about helping the patient.
Correct.
Period, just teaching them.
Yes.
And that's one of the things that we connected on several years back, just with the holistic approach that we have in our practice. And then when I learned about those things you were doing, I was like, oh my gosh, I didn't know pharmacists did this.
Yes.
It almost blew my mind, like, wait a minute. And so very, very cool. All right, what else do you have today?
Yeah, so we also do pain cream. So pain cream, we can incorporate an anti-inflammatory, a numbing agent, or a muscle relaxer, as well as a nerve suppressant in there. So temporarily, if you need the patient to feel some sort of relief before your specialty comes in, is they can get on a pain cream locally at the area that they have pain. The cream is filled up here, and you can remove this, push from the bottom bottom up and the cream come out of there. So a lot of patients, they start on this maybe just a couple weeks while they get some sort of treatment, to help with the pain. We do ear drops, as well as antifungal solution works really well. If a patient has some sort of a fungus on their feet or on their toenail or on their nails, taking a antifungal medication actually really affect their liver in the long run, and you have to be on that medication for at least probably 5 to 6 months before it clears out. So these are great products to advertise to podiatrists because they love this. The solution, what it has is an antifungal in there, an anti-inflammatory, in an alcohol base that will penetrate under the nail bed, on top of the nail bed, and they just brush on the area, and they do this for a couple of months without taking an oral medication by mouth, and this will help stay that local area so you won't get that side effects.
Okay, very cool. Very cool.
Yep. And then a couple more things is we specialize in a lot of natural supplements, like professional grade supplements. They absorb better, and they have less contaminants compared to the nutritional grade that you see at like a Kroger or CVS or Walgreens. Some things to look for is if you're on a fish oil every single day, or if you're on a calcium supplement every single day, they do have some sort of contaminants if you don't get a good supplement. Yeah.
Okay. So if you see the sign in the back, it has a number, but compounding, supplements, functional medicine, mailing available, health is our top priority. It's so much more than just a pharmacy. It's a lot more to offer the patients and help them in so many other ways. As far as curbside pickup, do you have any of that available right now?
Yes,
okay.
Yeah, we do have curbside pickup. So besides mailing, and we mail within the state of Texas for compounds. We also do supplements outside of Texas as well if you need, or curbside pickup is available. So if you call the pharmacy, we can ring it up and then bring it out to you.
Excellent. Now location,
Yeah.
because you mentioned you just moved, you've been around the hospital for over a decade.
Yes.
Where's your new location, where we're at right now, and phone number, other contact information?
Yes. So in October of last year, we moved and we joined TransMed Health and Wellness Complex. So we're really, excited to be here because this is where the vision is, where we do functional medicine and holistic care. So you can call us at 936-756-4254. If you have any question, we pick up the phone right away. You can also message us through our website at www.robertspharmacy.com.
Awesome. Thank you so much. When she said a beautiful new building, she's not kidding. She's actually on the first floor. Those of you who've been following us, we are building out a new suite. So we're actually going to be neighbors, which we're super excited about. Van, thanks for being with us today. Any last comments and thoughts you'd like to share with our audience today?
Well, I want to let potential patients know that we are here to help you, and we try to be as friendly and as fast as possible with high quality and affordable care. So we are here to answer any questions you may have about anything, testing, supplements, compounds. So please give us a call and we'll be here for you. Thank you.
And she's not kidding. A couple years back, I don't know if you remember, my wife came and did some hormone testing with you.
Yes.
And that was before we had connected. I sent her.
Okay.
And anyways, but she had a great experience and you helped her a lot.
Great.
So
That's awesome.
anyways, as always, we wish you guys the best in health and wellness, and we'll see you next week.